Welcome to Delivering Miracles, a podcast to teach women like you tips and strategies on how you can have a safer pregnancy so you can bring home a healthy baby. I'm your host and your high-risk pregnancy expert, Parijat Deshpande. I can't wait to chat with you. I remember when I was younger, I think I was probably in high school or maybe junior high, and there was this huge news story that was blasted everywhere about this woman who drowned her children. And there were images of the babies and the family and this woman all over the TV. And I remember just hearing all these stories that they were sharing on the news, hearing stories about her, hearing my friends and my family talk about her. And there was so much of this message of what was she thinking? What a horrible person she must be to do that. And what kind of mother kills her children? There is clearly something wrong with her. And those were the messages that were surrounding this awful, awful tragedy. And having been so young and not really having any exposure to anything else, I started developing that story in my own head too, that, oh gosh, maybe there was something really wrong with her. Maybe she wasn't fit to be a mother, because those were the only messages that I was hearing. And it wasn't until I went to my graduate program in clinical psychology when I really started to understand what mental health really is and what psychopathology really is, meaning when there are mental health challenges. What does that mean? And what does it do to us? And how is it different than who you actually are? It's what you're going through, but it doesn't define you. And I always remembered and went back to that story every time I was learning through my graduate training and thinking back to this woman, thinking, gosh, she got a really unfair representation in the media for being this monster of a person when she really wasn't. She was struggling with mental health issues and nobody was helping her. And yet through my graduate training, I still didn't get enough of that maternal mental health piece. There's general mental health that we could try to apply to new moms, but let's face it, maternal mental health, the mental health challenges that women face after they have a baby are really, really unique, because the pressures and the demands on you are so different than most other times of your life. And yet there's so little support. There's so little information, and there's way too much judgment. There's questions about who's monitoring mom and how often do we check in with her and how do we check in with her and where do we send her? And we've got to figure that out. We've got to tighten that process, because we are leaving mothers and babies and families completely without help and support during a time when they need it the most. And I'm not okay with that. Which is why I am so, so glad to have my friend and colleague, Dr. Kat, on today to talk about maternal mental health and specifically what the medical field, OBs, pediatricians, physicians need to know about maternal mental health to help moms get the support that they need as quickly as possible. Dr. Kat is a psychologist specializing in perinatal mental health, and she's the creator and host of the Mom and Mind podcast, which is so awesome, by the way. She's in private practice, seeing individuals and groups, and she also volunteers with Postpartum Support International and works with San Bernardino Company's Maternal Mental Health Work Group as a subject matter expert to provide training to local mental health and allied healthcare providers. And just in general, she's super awesome. Welcome, Kat. I'm so, so glad that you're here.
Well, thank you for that introduction. I'm going to take you everywhere with me. I'm happy to be here.
So we've been connected for so long. We talk about this stuff together. And I felt like this is such a great opportunity to bring this to a wider audience, because we need to talk about this. Mm-hmm. So before we jump in, because there's something really specific, a particular story I want to talk to you about. Before we do that, though, can you tell us a little bit about what you do and how you got into the work and the field of maternal mental health?
Absolutely. So I am a perinatal mental health specialist, which means I help moms and dads and families with the transition into new parenthood through pregnancy, through perinatal loss, and through postpartum difficulties. Here in my office and in the group that I run and through the podcast, I do trainings around here to make sure that as much as possible, whoever will listen to me, I will talk to them to try and get them training and information on perinatal mental health and very specifically why it's so important for us to be paying attention. And I got into this because I went through it. I was a psychologist working in a major hospital. I had been for several years, and I got pregnant with my first child and had thankfully a very safe and healthy pregnancy. And then shortly after birth, maybe within the first day, I noticed a pretty significant shift looking back now. And it took me about a year to figure out, until my daughter was about a year, to figure out what I was going through, which was postpartum depression, postpartum anxiety, and postpartum OCD. And I can talk a little bit about what those are if needed, but I was suffering, and I didn't know that I wasn't supposed to feel that way because no one had talked to me about perinatal mental health issues.
Yes.
And I didn't get anything in my training. I went all the way through grad school, internships, everywhere, and it was not talked about in any depth or length at all, other than just like, oh, this is something that can happen. And then that was pretty much it.
That was kind of it. Yeah, I totally agree. It infuriates me now looking back how little support and training we received in this. It's ridiculous.
Oh yeah. Yeah. It is. It's horrible. And it's a disservice to basically everybody because we all are born, and on some level, there's some spectrum of what can happen in the perinatal period that is affecting all of us. It might not be the same exact story and it might not be the same intensity, but we're all affected on some level, whether it's personally or with a family member.
Absolutely. Absolutely. I totally agree. It's one of those things, like you're saying, each and every one of us is impacted by it.
Yep.
Each and every single one of us. And so it becomes an issue that each and every one of us needs to deal with.
Yeah. So here's the paradox that it absolutely affects all of us. But as you mentioned before, nobody talks about it. And in addition to that, all the expectations about what motherhood and early parenthood is supposed to be like, pregnancy and all that, is held in such high expectation and such high regard that it's not even a possibility to not have an easy time.
Yes. Because there's almost like this dichotomy, right? Of you must love and appreciate and be so overly grateful for everything, and that you cannot feel anything else in addition to that.
That's ridiculous. I mean, I'll just put that out there. It's ridiculous. It doesn't happen anywhere with anything else. So why here?
No.
It's so romanticized in a way that, it's everything is the Hallmark version of reality. And I know that some people really do have an easy time and have a lovely time and do fall in love and bond right away. That's awesome. But the vacuum of information and knowledge and awareness and outreach and many other things is for everyone really, really does us a disservice and sets us up to feel like failures.
It does. Yes. And I can tell you this. So as you know, I work with high-risk pregnancy specifically. So a lot of the women who are listening are either going through a high-risk pregnancy or have gone through a high-risk pregnancy. And that sense of failure is already there for so many of us because of how the pregnancy went, because of how early we delivered or whatever that might be. And then to feel like, oh my gosh, I can't even be happy after it's over, which it just adds so much pressure to this internal dialogue of, I am a terrible person. I'm a terrible mother, that I can't even enjoy this now that it's over.
Yeah, it's really hard.
And I remember when I had my 6-week postpartum check, my OB, who was lovely, love her to death, she asked just one brief question. How's your mood? How you holding up? You know, my son was born very early, so he was at the very beginning of his NICU stay. He was not out of danger or anything like that. So she just checked in very briefly, and that was kind of it. And I remember thinking, wait, you should talk to me more about this because I'm going through something really, really, really traumatic right now. So from your perspective, If you were to talk to OBs and physicians right now, if they were listening in, what do you wish they knew about maternal mental health, and what do you wish they did?
There's quite a bit. And I want to preface this all by saying that there are some amazing doctors out there, some amazing OBs and healthcare providers who really get it and who are on top of it and who have the most beautiful bedside manner. However,
absolutely,
there are quite a few who don't. And for any number of reasons, maybe their training or personality or whatever. But what I think is really challenging is that there's still such a disconnect between physical and mental health.
Yes.
They are two separate and distinct things, and never the twain shall meet, or however that goes. That it is, they're so solely focused on what's happening physically. And, you know, hopefully they're focused on really understanding what's happening physically, but mentally, emotionally, I mean, this is all a system that is perfectly connected. Our brain and body work together. They do not work separately. And I think it's imperative to, as a culture, I think for medical providers to begin to connect the two and be having real dialogues about how mental and emotional health and wellness is impacting physical and vice versa. How they're doing physically is impacting their mental and emotional well-being.
Absolutely. Absolutely. So one of the things that I know comes up is, and I've heard this a lot, I remember especially back in my therapy days, is what if I get my baby taken away from me if I tell my doctor that I'm depressed? Mm-hmm. It's a huge fear that moms have. And you recently shared a story of a woman who had a really difficult and scary experience too. Do you want to talk to us a little bit about that?
Sure. So that there was a post that went viral on social media from a woman named Jessica Porton. And she'd posted on just the other day, Friday, about her experience of going to her OB's office, had several multiple missed appointments, or they kept rescheduling her appointment. So she had her visit 4 months postpartum. She must somehow knew what was going on. She was having depression and postpartum depression, and was having such an intense time that it was feeling like rage. And postpartum rage, by the way, is a thing that actually happens. Mm-hmm. And it's connected with, well, many things, sleep deprivation and depression and high anxiety sometimes. But aside from that, she mentioned these things to, I believe it was a nurse practitioner. And the way she described her experience from there on out was as if people just disconnected from her and went through these really mechanical kind of checks on her physically. Apparently, the cops were called to come and retain her. She was taken to the emergency room. And as I recall, she was there for about 10 hours with her baby.
With her baby.
Mm-hmm. And held and questioned. And it was just a horrible, horrible experience. And this is part of the reason. Stories like this are exactly part of the reason why people don't want to share with their medical providers, because they're worried that something's going to happen to them. They're going to be sent to the loony bin. That's what I hear a lot. Or their babies are going to be taken away. So there are many, many points at which somebody could intervene here. Someone could have had a consult. Someone should potentially be on staff in OB offices, a mental health professional. I mean, there's so many things that could be different here that could prevent this. One of which is, and by the way, I will follow up with her story. She's being taken care of, as far as I know, and a lot of organizations have stepped in to advocate for her and make sure she has appropriate resources. So I'll get to that when I tell you what's going well. But she's already having a hard time. She goes in for help, says very specifically that she needs support and she needs medication, and she's sent to the emergency room. And I don't know what her personal experience is, obviously, but potentially traumatized by the experience. Her stress levels are probably not reduced by the way things are handled and managed. And also, it's been entirely depersonalized. It doesn't sound like there was really any further, inquiry. I think she made it pretty clear from her story that she didn't want to hurt herself or her child, but she was having really difficult, intrusive thoughts, from what I can tell. And the medical provider, clearly, in my opinion, was not trained in perinatal mental health and didn't know probably the questions to ask, what to look for, how to differentiate somebody who has high anxiety versus somebody who is in actual risk of hurting themselves or their child, which is such a low percentage.
Right.
Such a low percentage. Most moms are terrified of their feelings, and they are doing everything they can to not engage in any of those scary thoughts that they're having.
Absolutely.
But the providers weren't trained, and the office didn't have a policy, as far as I can tell. I'm going to assume, these are my assumptions, that the providers weren't trained, that the office did not have a policy on how to manage this, and that they didn't have resources set up to give her. And those three things would have, taken care of most of this.
And it's not just that clinic or that particular provider. It's all over the place. Because of, I think what you said earlier is that there's such a disconnect between physical and mental health. This is not my realm. This is not what I deal with, which is totally okay, by the way, because like you mentioned, there are some amazing providers that are out there. There's a lot of providers I work with who are so good because they know that line and they say, okay, this is outside of my scope of skill. I'm going to refer you to a specialist who knows how to help you. But I remember being at a conference last year where we were talking about the referral process between obstetricians specifically and their referral process to mental health providers or, maternal wellness providers. And the numbers, the percentages are so low. The percentage of OBs who actually take the training is really low. And the percentage of providers who actually make the referral is so tiny. I want to say it's something like 5 or 6%. I could be wrong about that, but it was really tiny. And then you think about the number of women who actually follow through on the referral is even less than that.
Right. And there are some very manageable, easy, small tweaks to a daily practice that could change that significantly.
Yeah. What comes to mind? What would you recommend doctors consider?
So have a referral list. It's not like most doctors have an office manager, have front desk staff, have people on staff who can help gather a referral list, and just have copy paste, have a list of people to refer to in your area who specifically treat and support women through perinatal mental health issues. There are not a million of us out there, but the community of people who are trained is growing. Yeah. So that's one thing they could do. Another thing is that they can do screening to screen for postpartum depression. And as a matter of fact, ACOG and the U.S. Preventative Services Task Force have both put forth recommendations for that to be done in OB offices. Yep. And so it's not out of left field to include this in their process. And, having a screen in place, we can do a whole episode about screening, but if office staff takes an hour out of the year to get a training on doing a screening, how to implement it, and how to talk to the people who are having difficulties, it would do just so much good. And it doesn't take that much time.
Oh, man. It really doesn't. And can you imagine the experience the patients would have?
So much better.
Of being able to walk in and know, oh, wow, my doctor's considering and thinking about my emotional health. Even if I haven't said anything to anybody, she or he is asking me about it.
Yeah.
That's amazing.
Yeah, it really doesn't take that much. I think what happens, and I don't know how medical offices do billing, but some of the things that I've heard in terms of why OBs and why pediatricians don't offer screening and don't offer referrals, something to do with liability, or they're saying that if we screen, who are we going to refer to? And personally, I feel like the do no harm sort of oath that doctors take is wrapped up in here. If you're going to be treating people, you got to learn about what's going on with them. And one of those things could be mental health related issues related to the perinatal period. And honestly, you don't even have to do it yourself. Have an office staff member just research who's in your local area or online groups or something and put together a list of 5 resources.
Yes.
Yeah.
Yes. I love that you're saying that because it really shows how simple it can be. We're not talking about a major overhaul of the entire obstetrics field.
No.
We're talking about very small changes. That said, though, there are women that are listening who are going, I wish my doctor would do that, but my doctor is not doing that. What can they do if they feel like something's up, but they're either scared to say something because maybe they're afraid they're going to end up in the ER for 10 hours or they're afraid their baby's going to be taken away, or they think their doctor's going to judge them. What do you recommend our listeners do if they're in that situation?
Well, I guess I would say first, if you do have a doctor who you already know to be super judgmental and short and not supportive, if you can get another doctor, do that. But in addition to that, pulling up resources for yourself to take in with you can sometimes be helpful. If you go to postpartum.net, which is Postpartum Support International's website, they have lists of symptoms and things like that that you can look through and even print it out and take it to your doctor and say, hey, look, this organization that does this, that this is their life's work. They said that these are the symptoms I'm having, and they said that there's help for me. So sometimes doctors, unfortunately, like when they're busy and, if they're not trained, if they see some research or some organization that is supporting what you're saying, that kind of helps them understand too. And that can be, again, it's you doing a little bit of work in order to, just either bolster yourself. But certainly if you feel like you have to make your case to somebody who's not listening to you, then go somewhere else if you can. That's not always possible.
Absolutely.
But advocating for yourself is really important. Unfortunately, because so many doctors, OBs and pediatricians are not trained in perinatal mental health, what I hear is, people coming back to me and saying, well, they've never heard of this, or that they told me it will pass in a couple of months and I should be fine.
Right.
And they're not, really asking any more in-depth questions. And I will say that you, as the person who's going in for help, your intuition and your sense of yourself is really important. If you have a doctor who's dismissing what you're saying to you, that is a red flag to me with working with that doctor. But just because they don't understand it, just because they haven't had the training and they don't get it, doesn't mean it's not real for you. And you can still go and look for help somewhere else. And there's tons of resources I can give you.
For those of you that are listening, that is so massively powerful. Just because they don't understand it doesn't mean it's not real for you. Holy cow. Yes. That is, oh my God, I have chills. That is so it.
Yeah. Yeah. It's hard. I mean, you're going in there, you're vulnerable, you feel vulnerable, possibly sharing something that feels scary. And man, if they can't meet you where you are, it's really deflating, and it feels, it can feel invalidating. And oftentimes I hear women just kind of feeling like they have to crawl back in their shell and just suck it up and deal with it on their own. And I'm just telling you, you don't have to. And you were right. They're not right.
Yes. Which is a huge mind shift to have, because we are in a culture where we like to believe doctors are always right, which you and I both know is not true.
Yeah. Yeah.
And so this is a huge mind shift, that not only are you now stepping into this role as mother and voice advocate for this tiny little human being, and to trust your voice for that, but you should also trust your intuition and your gut instinct about yourself. Yeah. And that you may have to override what your doctor is saying in this case too, because you are right about how you're feeling.
Yeah. That people know when something's not right. And, sometimes we so don't want to know that something's not right that we'll kind of lie to ourselves about it. And that's, because who wants to feel bad and who really wants to come to grips with like something is wrong or not right, I should say. I don't want to use the word wrong because it's fixable. It's something that can be managed, but you're definitely not feeling yourself. And listen to that. Listen to that and keep talking until somebody hears you.
Yes, absolutely. What do you do in the case where, say, the woman, she's listening in right now and she's going, yep, I knew it. I knew something wasn't right. And now I'm listening to this and now I know for sure I need support. I know my doctor isn't going to listen to me. And I don't have a lot of people around me who are supporting me saying that, hey, this is real. They're telling me it's okay, get over it. What I hear from a lot of my clients is their family members say, well, it's over now. The NICU stay is over now. The high risk pregnancy is over now. So get over it, move on, be happy. How can women get the support? I know. Well, how do they cut through that jungle of noise to be heard?
It is hard. It is hard. And sometimes it's hard to find your soft place to land or your champion, someone who can fight for you and with you. sometimes it's a matter of looking outside of your family, outside of your friend circle, and finding a therapist or finding an online support group who's, and for these are people who are specializing in perinatal mental health, doing a search online locally. Certainly, as I mentioned before, Postpartum Support International is a fabulous organization, and they have coordinators all over the globe. And certainly in the US, if you go to their website and look up in your state who to talk to, the support person on the other end of the line will help you get connected with local resources. Occasionally, there won't be anybody in your family or your circle who gets it. And still, if you know something's not quite right and you need more, go outside of that and get an additional resource.
Mm-hmm.
Yeah.
Absolutely. And I love what you're saying here. The theme really just speaks to me as keep trying and keep trying and keep trying, because the support is out there and you do deserve it.
Right.
And it may not come the first try or the second try or the third try.
Yeah.
But it's there.
And I think it in particular is very difficult for people who are experiencing anxiety or depression and caring for a newborn, or maybe they are dealing with trauma, to keep trying. Because it can be very exhausting to keep trying. But if you can, I would really suggest, even if it's just making one call a day or breaking it down into like, okay, I'm going to take 5 minutes to call these 3 people, just small, manageable goals that don't feel too overwhelming. Because otherwise it gets tacked onto the list of the 5 million other things to do. And it's very easy for it to not be attended to when you're overwhelmed.
So true. So what can women do if their OB is telling them, give it a couple months, you'll be okay? Their friends and family are saying, it's over now. Mm-hmm. It's fine. Everything's fine now. And they're on the fence, right? Like, how can they know that it's time to get professional support versus I just need to take another walk around the block?
Sure. Yeah. Oh my gosh. The go take a walk and you'll be fine thing drives me insane.
Right.
Yeah. No, that's not going to fix everything. Right. So some differentiation between what's kind of manageable and what's not might be good here. So just in the spectrum of what can happen after birth, if we're focusing on just that, although depression and anxiety can absolutely start during pregnancy and difficult experiences absolutely can happen during birth. When we're looking at mental health and trying to differentiate between what's kind of like manageable and will maybe go away versus something you need help with, like baby blues, for instance, are within the first 2 weeks after birth. And that's akin to like a really difficult PMS. You can have mood swings and crying and have difficulty, but it kind of subsides on its own and you're sort of okay after 2. At max 3 weeks, you start to kind of get back to yourself a little bit, but still you're sleep deprived. So things aren't great. They're not perfect. When we start to be more concerned is when you feel like you're not able to function. And that can be anywhere from, let's say you feel down. If you're depressed, you might be feeling like a down mood, not having much motivation or energy. It's hard to concentrate. Certainly sleep is impacted even more so than it would be just with the normal sleep deprivation. And it can get pretty intense. You can start having really difficult thoughts of, and this is when we start to get into the higher concern, is when you're having thoughts that you'd be better off gone or be better off dead sometimes. Or you start having sort of escape fantasies is what I call them. It's like, I want to get in my car and drive and drive and drive, and I just need a break. Those kinds of feelings, when it feels like you're just barely making it through the day and slogging through, and your thoughts are just constantly negative and self-judgmental, and there's no real way to break through that. Ideally, before you get to that point, you can have support on board so it doesn't get to that point. But certainly the harder that your days are getting, the more likely it is that you could use some professional support to get through. And that's kind of the spectrum of depression that can happen. With anxiety, it could look very different. Anxiety sometimes looks like very, very busy mamas who are constantly cleaning and who can't take a break and, having a hard time resting even though they're tired, and certainly sleeping even though they're tired, those kinds of things. Your normal functioning, when it's impacted, that's when it's time to look for help.
Yes, absolutely. And I'd love to add here too that for those of you that are listening, going back to what Kat said earlier, there's a very strong physical and emotional connection.
Mm-hmm.
And so when you're feeling this way emotionally, it is probably also presenting itself physically.
Mm-hmm.
So if you're having trouble with your milk supply, that's a huge one that I see, especially with my preemie moms. It's one that I lived through for sure. It may not be the only cause of your low milk supply. I know it wasn't for me, but it is a factor for sure. There is a way your body's trying to get your attention. I ended up developing an autoimmune disease because of the stress that I was under and not having any support going through it. It happens. And your body is going to be screaming at you to get this attention and get some support until you pay attention to it.
Yeah. And the levels of stress that you're going through will absolutely impact you and your ability to get through the day. And you're right there. It just keeps kind of getting more intense until it's addressed.
Absolutely. So then a big thing that I know comes up for so many of us moms is, but I'll be fine. I can do it. I'm not weak. I'm strong. I can do this.
Yuck. That weak word. Yep, I hear it too. So,
what do you say? What do you do? What message do you have for women who are thinking that right now?
I don't know when the tide shifted from it taking a village to raise a child to that you have to do absolutely everything on your own all the time.
I know.
But it did. It's that now. It didn't used to always be that way. We used to have supportive, well, I don't know about in the US so much because it's in, just such a melting pot. There's so many different cultures here. But in like home cultures, where people come from other places, there's more often than not, there's a culture around mothers who are pregnant and postpartum that they are allowed to, they're supported. They get broths made for them. They get to lay in bed and bond with their baby. But here we don't have that. It's a I think we're still kind of working on the like pioneer pilgrim type mentality that like you go out there, you stake your claim and you do it yourself. It's not in any research I've ever seen proven that that's the way that it has to be done or that that's good for you. And I'm just sort of taking a step back to look at the wider cultural piece, because I think it's important. That is the part now is that you're seeing pictures of moms with their babies on social media. They're happy, they're clean, their houses are immaculate, and they're doing everything. They look good, they have the newest whatever. And so it started to be infused into our mind that that's what we are supposed to be doing too, that you got to do it yourself. You have to do it all. And also your kitchen should be clean and food should be made.
Right.
That's just, it's not an accurate picture. If you were to walk into any mom's house, like first thing in the morning, last thing in the evening, there's stuff everywhere. It's normal life is happening, but in our minds, it's supposed to be perfect. And this culture of perfection, this culture of like individualism at all costs is, I think, on some level ruining our transitions into motherhood, that we feel like we can't ask for help and we're supposed to do it on our own. And frankly, I think it's detrimental. I think it's hurting us all.
It's detrimental to moms. It's detrimental to the child, and it's detrimental to the entire family.
It is. And this is all like an inner battle too. The mom is there, working so hard. Usually, like, I have rarely come across someone who is literally just sitting there doing nothing.
Right.
Unless they're incapacitated and they can't get out of bed. And then that's a medical condition. Like they need support and help. Most moms are doing 5 million things a day to just keep the day going, and then still not feeling like that's good enough, and then still not asking for the help that they need. There's some other factors that go into this too, is that sometimes, a lot of the moms that I see that are having a hard time are not near their family. They don't have family support around. That makes it really difficult, or maybe they financially are not able to like pay for additional support. So there are real life factors that go into this. But if you have the opportunity and chance to get help and support, please, I'm begging you, ask for it.
Yes. And it's not selfish to do that. It's actually helping you to be a better mother, a better wife, a better person. in your life.
Yeah, absolutely. It's absolutely necessary to have a break. I mean, sometimes you have a baby on you all day and you just need to not be touched. If you can get a 2-hour break from not being touched, that is part of self-care. That is part of what helps you to come back and be present for your baby and do the next 22 hours.
Absolutely. Absolutely. For those of you that are listening, I hope what you're taking away from this is that your mental health matters and it is critical to your health and the health of your baby. There's nothing wrong with you if you need support, right. But speak up because you will find the support you need and deserve. Kat, what are your final words of hope for women who are pregnant right now and are anticipating possible postpartum complications, or who are postpartum right now and are listening going, oh my gosh, this is me?
Yeah, there is absolutely help available for you. There are trained professionals more and more every day who are learning about perinatal mental health and understand really what this is about, and who will not judge you, who will help you get the resources that you need and help you out of the funk if that's what you're in. There are beautiful and very passionate organizations doing this work. As I mentioned, Postpartum Support International, 2020 Mom, the Postpartum Stress Center, the Selene Institute, so many more. I can't even name. Postpartum Action Institute, just many people coming at these issues from multiple angles to try and get out advocacy and support and resources and trainings, even to doctors. Their Postpartum Support International is putting out, they're working really hard on trying to get medical professionals trained so that these things like we were talking about with the woman Jessica don't happen again. There is legislation and bills being put through with 2020 Mom. They're working hard to get things changed so that, and they just did a huge white paper last year on the state of maternal mental health in California. So they're working very hard. On so many levels, people are working on this. For the mom in her house who's dealing with this, it's a matter of reaching out, and you don't necessarily have to do the search on your own to find the help. If you find Postpartum Support International, find a coordinator in your state, in your area, they will help you get to some trained professionals. And I really, really want moms to know that you're not alone in this. There are so many mothers who go through this, unfortunately, but it's not you. It's not just you. It's not all in your mind. You did not make this up. You would not wish this on your enemy, I'm sure. It's not something you wake up and choose to feel. It's something that you're going through, and you can feel better with the right help.
I love it. Oh my gosh, I love this so much. Thank you so much for being here, for sharing your advice and your wisdom. We're obviously going to have you back because we have so much more to talk about related to this and so many other things. Yeah. But for this topic today, I just really want to appreciate you for being on today.
Thank you so much for having me.
Thank you. Oh my gosh. I have so much to say, and I know that she's just as passionate as I am about this, if not more so. And it's just a conversation we have to have, and it's not going to stop at just one conversation. We're going to keep talking about this because you and I both know that once baby is home, it's not always over. And there are so many complicated emotions that can come up. Maybe they're hormonal driven. Maybe there's something else. Maybe it's because of the trauma you've been through. It doesn't matter. What matters is that your mental health is important, and it's critical to your health and the health of your baby, and that it says nothing about you. You did nothing wrong. You're doing nothing wrong. All you've got to do is speak up, because you will find the support you need and deserve. Thank you so much for joining me here today. If you enjoyed today's episode, I would love it if you could head over to iTunes and leave a review so more women who are going through a high-risk pregnancy or had birth trauma and are trying to heal postpartum can tune into Delivering Miracles to receive the inspiration and tips and motivation on how to heal after it's all over. And if you had a high-risk pregnancy and you're looking for support postpartum, you've got questions, you've got things on your mind, and you want support on helping yourself heal after everything you've been through, head over to parijatdeshpande.com/postpartum and reach out, because I would love to know how I can support you too. And also, I'd love to stay in touch. So follow me on Twitter, Instagram, and Facebook at Parijat Desh. That's PARIJATDESH. You matter. Your health matters. How you feel matters. You are important, and you deserve whatever support you need to be the best mom you can possibly be, because you deserve to be happy and enjoy this life that you fought so hard for. Take it one day, one step at a time. You can do this.